Bismillahirrahmanirrahim and Assalamu alaikum. Our today's lecture is about criteria of normal and abnormal behavior. By criteria we mean that how we can differentiate between normal and abnormal behavior. So there are various criteria upon the basis of which we can differentiate between normal and abnormal behavior. Now, the average behavior of ordinary people is held to be normal. Average behavior. By average behavior, we mean that what most of the people do in any society is known as normal behavior. Average means mostly. What is the behavior which is shown by most of the people? It is known as normal behavior. The individual who deviates from or acts differently from what is normal is called abnormal. So anyone who acts differently from what most of the people do would be termed as abnormal individual. The abnormal individual is multidimensional. Multidimensional means that there are many ways to describe abnormal behavior. Upon the basis of very limited information or only one or two behaviors, we cannot describe a behavior as an abnormal behavior. Now, this is the criteria of normality and abnormality. First is statistical criterion, medical criterion, social approval criterion, personal distress, personal disability, and unexpected behavior. First is statistical criterion. Statistical criterion means the average behavior of majority. Now, you should be knowing what is meant by average. Average is what most of the people do in any society. So it means that whatever the behavior which is shown by most of the people in any society, it would be termed as the normal behavior. Behavior displayed by most of the people is normal, and behavior shown rarely would be abnormal. So the behavior which is shown very rarely in any society, it would be termed as abnormal behavior according to statistical criterion. Now, the criticism of this criterion is that behavior of intelligent, creative, and artistic people is not in conformity with the majority. Conformity means that it is not in accordance with. You see, very highly intelligent people are very few, and their behavior is also very rare. Creative individuals and their behavior, artistic people and their behavior, it's very rare in our society. But we will term those individuals as highly intelligent individuals and not as abnormal individuals, because their behavior, their activities, their talent is not shown by most of the people in any society. And according to this criterion, we should term their behavior as abnormal, but actually that is not normal, rather that is supernormal behavior. It's above the average behavior. And there is cultural difference as well with respect to what is normal and abnormal. You see, within the society, if one thing is considered normal, then in the other society, that thing might not be considered as normal behavior. Is it clear? There are so many gestures, so many behaviors which are considered very appropriate in one society, but which are considered very less appropriate in other society. So we can't say that it is a universal criterion. It is not a universal criterion. Second is the medical criterion. Now, according to this criterion, the individual who does not have symptoms of mental disorders would be called normal. Individuals who do not show symptoms of, there are so many mental disorders like anxiety disorders, there are personality disorders, there are obsession compulsions, there are phobias, there is schizophrenia. So those individuals who do not show these types of disorders, they would be normal, and those show these symptoms or these mental disorders, they would be abnormal individuals. Now here the criticism is that normal people, they also show anxiety, restlessness, frustration, but they cannot be labeled as abnormal. There are certain occasions in our life where we get anxious, we get restless, we get frustrated due to any life event, due to any stressor in our life, but we won't term our behavior at that particular moment as the abnormal behavior. What matters is that intensity and recurrence of symptoms matters to label someone as abnormal. Intensity means that how much severe that symptom is. The particular symptom which is displayed by any individual, how much severe that symptom is. If that symptom is not very much severe, then it will not lead to label an individual as an abnormal individual. And recurrence, how repeatedly that symptom occurs. In mental and psychological disorders, symptoms, they frequently occur. They show frequently, they reoccur. So, if that symptom is occurring once in 6 months or in a year, then we won't say that that is the sign of abnormality. Is it clear? Then the third criterion is social approval criterion. Social approval criterion means that the behavior which is approved by society is considered normal. So, whatever our society approves, whatever our society says that this is right and this is wrong, here the concept of conformity comes, that we conform to the society, we obey the rules and regulations and norms of our society, then we are normal individuals. And normal individuals, they are aware of their rights and duties. They know that they have to get their right and they do not have to encroach upon the rights of other individuals. Rather, they have to respect the rights of others as well. So the criticism of this criterion is, again, that there is a cultural difference. Every society has its own standard of approval. We can't say that this is a gesture of showing respect. For example, any gesture of showing respect is same in all cultures. No, it does not mean this. We can't say this thing. These gestures, they differ from one society to another society. Deviation from social criterion is undesirable, but it's not abnormal. You might have seen that in your own society, there are so many individuals who do not follow these social norms. For example, if we talk about fashion only, then with every passing day, you find variation in fashion. Fine. So, the society may approve that or it may not approve that. But it is not considered as abnormal. For the time being, it may become undesirable, but it is not abnormal. So, we can't say that it is the criteria of difference between normal and abnormal behavior. Then the next one is personal distress, personal discomfort. Now, abnormal people, they suffer from very severe restlessness and anxiety. Now, these symptoms of restlessness and anxiety, these are shown by patients of anxiety and depression. But these are not shown by patients of all disorders. For example, the patients of personality disorders, they may not all the time suffer from restlessness and anxiety. The patients of bipolar disorders, they are at the two extremes. At one time they suffer from depression, but another time they suffer from they experience very cheerful mood. Similarly, in certain types of schizophrenia. So, these symptoms are not the symptoms of all psychological or mental disorders. So, the criticism is that normal people may also experience these symptoms due to accidents and natural disasters as well. So, these symptoms of acute restlessness, acute anxiety, severe stress, These are also experienced by individuals who have met any accident, even who have seen any accident, or who have faced any natural calamity or disaster. They also experience such like symptoms. But we can't say that those people have become abnormal. Again, the thing comes that the severity, the intensity, and recurrence of the symptoms, it matters. If a person who has faced any natural disorder, any natural calamity, and is experiencing symptoms of depression, anxiety, very severe symptoms of depression and anxiety, and is becoming restless for a longer period of time, and there is intensity in the symptoms, then we will label that person as suffering from any psychological disorder. Otherwise, if those symptoms are momentary, then we won't label them as abnormal behavior. Then is a personal disability. The disability to adopt a certain behavior or carry out a specific activity is regarded as a sign of abnormal behavior. If you are unable to perform a task or any activity, then that will be considered as abnormal behavior. But the more specific or proper definition we say, which is given by Martins, it says that abnormal individuals, they cannot carry out mental processes and psychological activity efficiently. Like there is disturbance in their mental activity, in their psychological activity. There is disturbance in their perception, in their decision making, in their understanding of the situation, in their solving problem. So then we say that these individuals are abnormal individuals. Again, there is a criticism that sometimes due to natural disability, individual cannot perform a task or adopt a specific behavior. There is some physical natural disability, and due to that natural ability, the individual, they cannot perform a task. Worries of daily life bring about a disorganized situation, but it is not considered abnormal. Again, due to the tension, due to the stress, anxiety, people, they become unable to perform a task because they cannot understand or adjust to that situation at that particular moment. But again, that is very temporary, that is momentary, and we will not consider it as abnormal behavior. According to Neal and Davison, abnormal individuals show professional incompetence and failure to establish social relations. Neal and Davison, they are writer of a book, very famous book in psychology, which is known as Abnormal Psychology. And according to them, those individuals who lack professional competence, who are unable to make themselves fit in a proper manner in their professional settings and in making social relationships, those are the abnormal individuals. And the last one is unexpected behavior. Behavior which is not according to the expectations or fit in with the expectations, that will be considered as abnormal behavior. Fine. So again, the same thing, that sometimes this unexpected behavior is shown by normal individuals as it is the demand of any situation, which is very rare. So we will not label it as the criterion of the abnormal behavior. Fine. So how we can differentiate between normal and abnormal behavior? As you have studied all these criteria, you have studied their criticism as well. The main thing is adjustment. Our previous lecture was also about adjustment. How people, they are better able to adapt in their society, in their lives, better able to adjust with the changing demands of the environment. They are the normal individuals. That adaptation includes their professional settings, it includes their social relationships, it includes their family life. Everything is included in that adaptability and adjustment. So how better they are able to adapt, they are more normal individuals. And how you are unable to adapt, in a situation. So adjustment matters a lot in making or in labeling someone as normal and abnormal individuals. There is another criteria of normality and abnormality, which is known as 4Ds. It is basically the 4Ds are distress, dysfunction, danger, and deviation from normal standards. So it is just for your own for your knowledge that you should be knowing that this is another way of classifying normal and abnormal behavior. Now the characteristics of normal individuals. Number one, they examine their abilities realistically. They have realistic appraisal of their strengths and weaknesses. They know this is their ability, this is their potential, and how they can use it. They remain engaged in constructive activities. They avoid engaging in destructive activities. They stay away from muddled thinking. Muddled thinking is confused thinking. It is not very clear thinking. Their thinking is not very much haphazard. It is very much clear. They do not possess false beliefs and superstitions. You are very well familiar. Having false belief is a main symptom of one of psychological or mental disorders. Fine? So they do not possess such like beliefs and superstitions. They are flexible in their attitude. When they need to change their attitude according to the situation, they will change it. They will not be rigid in changing their attitude. They possess strong willpower. They know how to handle a situation. They are healthy and they have the strength of accommodating themselves in any situation. They do not get disappointed easily. Rather, they seek out what are the ways and means to avoid this particular type of problem and how to overcome or tackle it. They follow rules and regulations. They conform to the society. They pursue personal and social welfare. Their own personal welfare is not their interest only. You see, it is another sign of abnormality that people who are very much concerned about their own self, about their own well-being, and even if they have to risk the welfare of other individuals. Rather, normal individuals, they have personal welfare in their front and social welfare as well. They use their talents cheerfully. They are very cheerful personalities, very optimistic personalities. They show consistency in behavior. Their behavior is never inconsistent. We don't find any inexpectation in their behavior. Rather, their behavior is expected because there is consistency. We know that they are showing to behave in this manner. So there is sameness in their behavior and attitude. They maintain balance between their belief and behavior. There is the balance between what they think and what they do. If there is imbalance between these two things, then that is a strong discrepancy of attitude. They fulfill their needs in a legitimate manner because they are aware of their duties, they are aware of their rights, they know how to get their right and in a legitimate manner. They will not never encroach upon the rights of another individuals. They maintain balance in their expression of emotions. They know that this is a situation where they have to show anger. This is the situation where they need to make themselves calm down. So there is balance in their expression of emotions. And they discharge their social responsibilities in a productive manner. So these were the few characteristics of normal individuals. Inshallah, our next lecture will be about stress. Till then, Allah Hafiz.